Amid mounting humanitarian challenges, Yemen is once again at the center of an escalating health crisis. A new report by the Euro-Mediterranean Humanitarian Rights Monitor has revealed alarming statistics showing that the country now ranks third worldwide in the number of cholera cases. This report has more.
The Euro-Mediterranean Human Rights Monitor has reported that Yemen ranks third globally in the number of cholera cases, amid growing fears that the spread of the disease will worsen due to high levels of water contamination and weak sanitation systems. In its latest report, the International Observatory stated that cholera outbreak has become endemic in Yemen because of its widespread reach, the high number of infections and deaths, and the ongoing failure to address its root causes. The report emphasized that the persistence of cholera in the country reflects the continuing deterioration of essential infrastructure and the inability of local authorities to contain the crisis. According to the observatory, the spread of cholera in Yemen is directly linked to the collapse of water and sanitation networks, poor waste management, and the obstruction of access for medical teams and supplies. These conditions have created an environment in which the disease continues to thrive, placing millions of Yemenis at risk of infection. The report also highlighted that restrictions imposed on the work of humanitarian organizations have delayed or even prevented maintenance and rehabilitation of critical water and sanitation systems. Such restrictions have further hindered the ability of vaccinations and prevention teams to reach affected areas, compounding the humanitarian and health challenges facing the country. In the light of these findings, the observatory called for the immediate facilitation of the work of both local and international health organizations. It urged authorities to halt any targeting or monopolization of water resources, to allow urgent maintenance of water and sewage treatment plants, and to invest in the development of health facilities. The report also recommended increasing hospital readiness to handle new epidemic developments and ensuring that medical supplies and fuel reach all affected areas without obstruction. Between 2017 and 2020, Yemen experienced the largest cholera outbreak in modern history, with millions of suspected cases and thousands of deaths reported. Despite years of international attention, new cases continue to be recorded daily, reflecting the enduring fragility of Yemen's health and sanitation systems. The report warned that the ongoing lack of international funding and limited local capacity continue to place immense pressure on Yemen's already dilapidated health infrastructure. Without urgent intervention and sustained global support, the observatory cautioned the situation may deteriorate further, threatening the health and lives of thousands across the country.